My name is Taylor Held. I live in Great Falls, Montana, and I've had VNS therapy since I was age 16.
When Taylor was first diagnosed with epilepsy, I actually just thought maybe it was a mistake, that she would find another doctor to give her a different diagnosis and that it wouldn't be something that she would have to live with for the rest of her life.
I was diagnosed with epilepsy when I was in 8th grade, and it's affected me in different ways, not as much as it's affected Taylor.
She would forget things and not hear instructions completely. So we were always worried about where she was, what was she doing, who was she with.
Over probably a 6-month time period, her grades drastically dropped. Straight A student down to C's, lower B's, barely making it.
I started taking, I think it was 12 pills a day. I gained probably 30 pounds in 30 days on one of them, and one of them made me really depressed.
It was frustrating because they could never seem to find something that worked for her that would help her completely be seizure-free. When we first learned about the VNS therapy, it was a little bit scary to me just because of the surgery.
When we started looking further into it, and I can remember Taylor calling me up because it was me first that said, no, I don't want it. I don't want to take any chance at all of hurting you. She said, Dad, I need to do this for me. I need to have a normal life. And that's what did it for me. So.
I was implanted with VNS therapy when I just turned 16, 2 days after I was 16, and I've had it for 2 years now. It took me about 2 days to recover. I was just at home, and I hung out at home for a day, and then it just went back to everything, my normal schedule.
Probably within 3 months, we saw a drastic change, absolutely drastic change, where, Taylor was her old self again. It was like you got to see your daughter reborn again.
Before, when she'd just go into seizure, you can't really do anything. But with the magnet, it changes that. It makes it so she doesn't have a seizure, and it felt like I was actually doing something to help her.
When I feel like I'm gonna have a seizure, you just swipe it over it, and it goes off right away, and it changes your voice. Before I was taking 3 pills, and now I'm down to 1 every other day.
We've actually been able to do more things, like stay up later than we used to, and watch movies at night without lights on, because she can watch movies now in the dark, and then she can go to dances. She used to not be able to.
If I'm at a dance and I don't feel well because of the lights, just things that can set off a seizure, I'll have my magnet with me and I'll use it.
She's able to work. Now she can go out with her friends. She goes to movies more than she used to.
I hope to be an art teacher one day, not for preschool, smaller kids. I hope to be with high schooler kids or college kids.
Well, I'm proud of Taylor for a lot of things, that she is now graduating from high school and looking forward to moving out on her own. I think a few years ago, she really didn't ever want to leave the house and never thought that she would be living by herself in an apartment or on campus away from her family.
The most important parts for VNS is, for me, just how it's helped me live a normal life and how I can just be a teenager and be a kid.
The VNS therapy system is indicated for use as an adjunctive therapy in reducing the frequency of seizures in adults and adolescents over 12 years of age with partial onset seizures which are refractory to anti-epileptic medications. The VNS therapy system should only be prescribed and monitored by a physician. The VNS therapy system is not a cure for epilepsy, and since seizures may occur unexpectedly, patients should consult with a physician before engaging in unsupervised activities. The safety and efficacy of the VNS therapy system has not been established for use during pregnancy. Patients who smoke may have an increased risk of laryngeal irritation. The most commonly reported side effects from stimulation include hoarseness, prickling feeling in the skin, shortness of breath, sore throat, and increased coughing. These typically occur only during stimulation, are well tolerated, and noticed less as time goes on. The most commonly reported side effect from the implant procedure is infection. This summary represents partial excerpts of important prescribing information. The information is not intended to serve as a substitute for a complete and thorough understanding of the VNS therapy system, nor does this information represent full disclosure of all pertinent information concerning the use of this product. Full prescribing information can be obtained at www.cyberonics.com/manuals.